Hi there, welcome back. My name is Sheldon McLeod, and this is Thinking Out Loud here at SaltWire.com. There's been a lot of talk about healthcare over the last while, and there's a lot of discussion about not just retention. We've got student nurses currently preparing for a career to enter the system, and they're desperately needed. We have nurses who are coming here from other parts of Canada or even around the globe, trying to help all of us ease some of the burden that's on so many right now. There was an announcement that was brought forward by the Nova Scotia Health Authority announcing training and retention initiatives for nurses specifically in EDs or emergency departments. And as they say, a number of training and retention initiatives are moving forward. And I really wanted to talk about this with someone who is in the know. And the person that was made available for us to speak with, I very much welcome Dr. Gail Tomblin Murphy to the conversation. Good day to you.
Good day to you. Thanks so much, Sheldon.
Nice to see you again. And Gail Tomblin Murphy is the Vice President of Research, Innovation, Discovery, Chief Nursing Executive or Chief Nurse Executive with Nova Scotia Health. Tell me a little bit about this plan and when the wheels started working towards bringing this forward and making it public.
Right. Thanks so much, Sheldon. And I'd just like to say that it definitely has been a hard time for the system, and also would like to acknowledge and bring condolences to the two families who've lost family members. In terms of the retention of nurses and recruiting nurses, this has been something that we've been working on for quite some time. And the focus on emergency room and the report that came out earlier this week is really important. And so that being said, when I preface my comments with that, some of the announcement today that has come out, some of them we've been doing in terms of emergency room nurses, and also more broadly, other nurses as well, working outside of emergency rooms. But there are a couple of highlights that I'd like to share, and really they're focused on retaining nurses and supporting them. We know firsthand that it's hard out there. Yeah, they need support, and this release today is about that. A just-in-time program. What is this? Mm-hmm. Tell me a bit more. So if you look at just-in-time, it's when we're working short, definitely, and all nurses need some kind of support from other nurses. So oftentimes our experienced clinical nurses are those who can mentor best and offer the support, offer the guidance. But we find ourselves in a place that oftentimes nurses, newer graduate nurses, aren't necessarily benefiting from that experiential knowledge that comes from that seasoned emergency room nurse or other nurse. And oftentimes that experience is missing. And so we have heard from our nurses it's important to give us the kind of support that we need. So this is more like almost like call a friend or call a clinical person who can help. So what we're doing on the ground, we will be enhancing what we have in terms of our clinical nurse educators, so people 24/7 in the emergency rooms working with the teams. And in addition to that we will be strengthening what we have in terms of that champion role. So this could happen in person, but also online. And we have had, Sheldon, a really good fortune to have our retired nurses really step up and help us. And in particular, COVID-19 really helped with that. And what that means is we have had over 25 retired nurses, for instance, who have built programs for us, programs around mentoring, about precepting, and around supporting nurses. And so the announcement today is about making sure that is in place. And this will be a model in which that nurses will have quick access to information to help them to make their decisions. But in time, it also will be having that support from that clinical piece. So this is enhanced what the evidence has been saying for many years. There will be technology to help with this. And this will help nurses by having those decision tools to make those decisions, but also to run those by. So this is new. The second new thing today is that nurses and other clinicians, they're the ones who have the best ideas. They know what kinds of solutions need to be out there to deal with some of the challenges. And so we have, through our nursing strategy in the province, had the opportunity to help nurses. But this is an infusion of innovation funds. And so there will be nursing innovation funds, good ideas that nurses have, in emergency room, we'll start here, and then we'll scale to other parts of the healthcare system as well. And there's $150,000 announced for these innovation funds. There will be nurses who will be able to just put their great ideas in application form. Those will then be supported with some money. It could be $5,000, for instance, of $150,000. A total of $5,000 can go a long way to generate those ideas, but also to support those ideas. And that's what we do in the Nova Scotia Health Innovation Hub. So I'm pretty excited about that, Sheldon.
And I'd like to hear a bit more about like on the ground, because nurses, people in the system will say it's a human resource challenge right now. And I don't think anyone is denying that. What do you envision with a busy emergency department? It's 1:00 in the morning. There's a lineup of people. How is this specifically going to help those nurses do the work that they need to do to give the best patient care possible?
Right. Well, number one, we have to first work at getting that right team in emergency rooms and in other parts of the organization working together. So the registered nurse, the licensed practical nurse, the nurse practitioner, for instance, are one part of a team. And on that team, we've got strong paramedics, we've got physicians, for instance, and others who are working in this example, the emergency room. So what first we need to do is make sure that we have the teams working together doing the right things. And so if I add to the announcement this week, a patient advocate, so somebody in the waiting rooms helping people to be comfortable, to get them food and that kind of thing, but also having a clinical provider who circulates in that waiting room. And perhaps that could be a licensed practical nurse who can do vital signs, who can work to their scope of practice. So Sheldon, it's not always about getting more. We need more. We've got vacancies, don't get me wrong, but we also have to find ways to get our workforce working to their full scope of practice. So for instance, nurse practitioners can admit and discharge. We're only one of 4 provinces where they can admit into a hospital and they can discharge out so that they follow their care through. But nurse practitioners can also, for instance, get the community referrals, get the patients out where they need to be in terms of primary health care and what have you. So that's really important. They can also diagnose, they can prescribe, they can do a lot of interventions and discharge. And so you've got that piece, and then you add the physician assistant to that. And the reason I'm giving these examples is now we have a team of providers who can work together to their scope to deliver care very differently. But the key here, Sheldon, I'd like to say is that a lot of the work that we have to do is to get Nova Scotians care where they need it. So it's not necessarily in an emergency room. So we have all kinds of strategies to make sure, and you've probably heard of them, we've talked about them, our mobile primary care buses, our virtual care Nova Scotia, our walk-in clinics where pharmacists are working to their full scope of practice. So it's more than getting more numbers. That's important. But in addition, at the same time, it's also making sure that we strengthen the access that people have so that they're not landing in emergencies for some very simple kinds of procedures. And also our virtual emergency Nova Scotia has showed and demonstrated that's very, 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 very promising. You walk in, you might need care. Somebody will say, Gail, you're coming and you've got maybe, an infection, that you've had before, you need your prescription refilled. What about if you come over to a room? I'll go over with you as a nurse, or it could be a licensed practical nurse, or it could be a paramedic, and you're going to see a physician on screen. So the reason that I say that, Sheldon, is that 24/7 in the middle of the night, that we are working hard to make sure that we have those kinds of supports in place around the clock as opposed to banker's hours. And so that's so at 3:00 in the morning, when a nurse, and I'm a nurse, I'm a critical care nurse by background, and there would have been many nights that I would have somebody with me that I could talk to. I would run things by. I would make sure that we as a team made the decisions that we needed to make. And so that would allow me then also, in addition to having my team around me, I also can reach out and access other resources. And that's what the importance of this initiative is.
I do want to ask, since it is called Training and Retention Initiatives for Nurses, and I understand that technology can help, that giving the assistance and support is important. what, if anything, is being done to help where situations where nurses are saying, I'm not allowed to take my vacation, or I can't even go home at the end of my shift because we're working so short that I'm being asked to or forced to work overtime. And again, not to take anything away from what these new initiatives may be offering, but just to give some reassurances that those concerns are something that the department, that Nova Scotia Health is working towards helping with.
Right. So those concerns are the most important concerns. And we know from the evidence and many years of study that the longer that nurses work and the more fatigued they get, the worse the outcomes are for them, as well as they get tired, and we don't want them doing that. So that needs to be front and center. And what that means is, for instance, we know we've got large vacancy rates. We have jobs for anybody. So we have been reaching out to registered nurses, to nurse practitioners, to physician assistants and others to hear from them. We have posted on our website today, and also I can leave with you. But if you want, if you have an interest in working with us, you're in the province, you're elsewhere, we want to hear from you. So what we need to do at the same time, Sheldon, is we need to bring people into the system. We need to make sure that we have that cadre of a team to deliver that care. And in addition to that, we run in my portfolio a specialty program. So nurses, for instance, they finish their degree, and then they do a certificate program in emergency room nursing. We have other ones, critical care and perioperative and advanced paramedics and things. But on the emergency one, then these nurses who are already graduated want to work in emergency. We support them with their tuition. We support their costs. And they come in and they learn about how to be an emergency room nurse. It's got some theory, it's got simulation learning, and it's got that clinical experience. And this is like not only in Halifax, this is across the province in 4 different locations. And so we're increasing this, we're ramping it up, and the support for nurses in terms of the retention is valuing their learning opportunities and offering them things like this. So what you've just said, you're right, it's not right. People can't be working around the clock, can't be not taking their vacations and things like that. And we're very, very, very well aware of that. And that is keeping me excited about these new types of initiatives.
And I guess to close this conversation, a lot right now has to do with managing expectations. And
Sure
when you say we're going to fix healthcare, people say when. And when we have tragic stories with tragic outcomes, that adds to the layers of frustration. And I'm not just talking about the public, but for the people within the system as well. So how do we then manage expectations of the things that we've just discussed that will help the workload, will help the support network, will bring in more bodies, more people to help? How do we manage that at this point right now, given all that we've just been talking about over the last couple of weeks?
So Sheldon, that's really important, and it's not a quick fix tomorrow, because it's not just dealing with emergency rooms. It's also making sure that Nova Scotians have access to care. So as you're aware, we've been testing and trying some pretty good solutions, and things like virtual care, Nova Scotia, walking into pharmacies and getting care that way with nurse practitioners as well as pharmacists working to full scope. By having our virtual emergency, those are things that are scaling, because we know they're working, and we're scaling them broader and faster, and that's going to be really important. In addition to that, the Premier had the Health Summit earlier this week, where it is very clear our providers, our unions, our associations, our regulators, our academic partners, they're in this together. This is bigger than one organization to solve on its own, or the system to solve on its own. And so it's going to take some time to do that. But what can't take time is access to care. And so that is some of those initiatives that were announced earlier. And it's also making sure, for instance, that we do have registered nurses, licensed practical nurses, and nurse practitioners throughout this organization and elsewhere working to their full scope. We believe that physician assistants are huge, and that's happening now. The clinical provider in waiting rooms, happening now. Patient advocates, happening now. So that there are strategies that we can't sit back. We know the evidence is there. We've tested and tried them, and now we're here to put them in place.
We'll leave that there for today. Dr. Gail Tomblin Murphy, Vice President of Research, Innovation, Discovery, and Chief Nurse Executive, Nova Scotia Health. Thank you so much for giving us some of your time.
Thank you so much, Sheldon. I really appreciate it.